Mosquito spraying in Bensalem and Bristol Townships. Imagine waking up to the hum of mosquitoes, knowing that these tiny pests could be carrying a virus that threatens your health. This is the reality for residents of Bensalem Township and Bristol Township, as the Bucks County Department of Health, BCDH, has announced an urgent mosquito control operation. The Mosquito Disease Control Program will be conducting an ultra-low volume ULV mosquito control operation on Monday, August the 4th, starting at 8:15 p.m. The goal? To significantly reduce the high populations of nuisance mosquitoes and those capable of transmitting West Nile virus. But here's where it gets controversial. While some residents may welcome the spray, others might have concerns about the chemicals used. Let's dive into the details. The treatment will be administered using truck-mounted equipment, targeting mosquito habitats in both residential and park locations. These trucks will be easily identifiable by the Bucks County seal logos on their doors. The equipment will dispense a product called Duet at a rate of 0.75 ounces per acre. Duet is designed to provide quick and effective control of adult mosquito populations. The good news is that these application materials have a very low toxicity profile to mammals and will have a negligible impact on non-target insects and the environment. However, some might still question the long-term effects of such treatments. In Bensalem Township, the treatment will focus on the area around Bensalem Country Club, bound by Atlantic Avenue, Brown Avenue and Humeville Road. Meanwhile, in Bristol Township, the spray will cover areas bound by Route 313, Bristol Pike, River Road, 2nd Avenue, Neshaminy Marine Drive, 5th Avenue, 4th Avenue and Coventry Lane. And this is the part most people miss. The effectiveness of these treatments can vary based on weather conditions and other unexpected events. If the spray operation cannot proceed on August 4th, a backup date of Tuesday, August 5th has been scheduled. Certain mosquito species carry the West Nile virus, which can cause humans to contract West Nile encephalitis. This infection can result in an inflammation of the brain, making it a serious health concern. According to the Pennsylvania Department of Health, all residents in areas where virus activity has been identified are at risk. So, what can you do to protect yourself and your community? Start by getting rid of standing water around your home. Mosquitoes can breed in even small amounts of water, found in items like flower pots, buckets, toys, and clogged gutters. Using bug spray and wearing long sleeves, especially around dawn and dusk, can also help keep bites away. To learn more about mosquitoes and West Nile virus, visit the Pennsylvania Department of Environmental Protection's website. If you have questions or want to report a concern, give the Bucks County Department of Health a call at 215-345-3318. Remember, your health and safety are paramount, and taking proactive measures can make a significant difference. But let's not forget the bigger picture. While these treatments are essential, they also raise questions about our relationship with nature and the environment. Should we be more proactive in preventing mosquito breeding grounds, or is this the best solution we have? What are your thoughts on the use of chemical treatments for pest control? We'd love to hear your opinions in the comments below. West Nile virus alert, protecting your family in Bucks County. The alarming rise of West Nile virus in Bucks County is a pressing concern that demands our attention. Recent reports indicate that after 11 confirmed human cases of this mosquito-borne illness emerged in Bucks and Montgomery counties over the last 2 years, proactive measures are now being implemented to curb its spread. The virus has been detected in various locations, including Bensalem, Homileyville, and Quakertown, raising significant alarm among local health officials. So far this season, Bucks County has recorded 20 instances of positive mosquito tests, while Montgomery County has reported 6. These findings come from the Pennsylvania Department of Environmental Protection, which has yet to confirm any new human cases this year. While specific locations within towns like Bensalem, Humleyville and Quakertown have not been disclosed, the initial positive mosquito samples were identified in late June across several counties in Pennsylvania, including Bucks and Montgomery. On a national scale, 15 states have reported a total of 49 human cases of West Nile virus this year. In the previous year, Bucks County experienced 3 human cases, while Montgomery County had 4. This year, the numbers have slightly changed, with 1 case in Bucks and 3 in Montgomery, as of 2023. In response to this growing threat, communities such as Lower Makefield Township have initiated mosquito control operations. These efforts include the use of ultra-low volume spraying in residential areas and parks to combat the high populations of both nuisance mosquitoes and those capable of transmitting the West Nile virus. According to officials from Lower Makefield, this treatment aims to significantly reduce the number of mosquitoes that pose a risk to public health. The spraying will be conducted using truck-mounted equipment. Targeting mosquito habitats in both residential neighborhoods and park locations. The spraying equipment is designed to dispense at a rate of 0.75 ounces per acre, ensuring effective coverage. The township emphasizes that the product used for this treatment is intended to provide rapid and efficient control of adult mosquito populations. Importantly, it has a low toxicity profile for mammals and is expected to have minimal impact on non-target insects and the surrounding environment. The treatment in Lower Makefield Township was scheduled to commence on July 22nd, with the hope of reducing the incidence of West Nile virus cases in the area. According to the Centers for Disease Control and Prevention, CDC, the number of human cases of West Nile virus has fluctuated significantly over the years. 9,862 cases were reported in 2003, 5,674 in 2012, 2,911 in 2021, 2,628 in 2023, and 1,791 in 2024. Looking ahead, Pennsylvania is likely to see an increase in West Nile virus cases as warmer weather extends the mosquito season, as noted by the State Environmental Protection Department and mosquito biologists. While most individuals infected with the virus may not exhibit any symptoms, the CDC reports that approximately 1 in 5 people will develop symptoms such as headaches, body aches, vomiting, and skin rashes. Furthermore, some individuals who experience a fever due to West Nile virus may suffer from prolonged fatigue lasting for months. But here's where it gets controversial. Are we doing enough to protect ourselves from this growing threat? As we navigate the complexities of public health and environmental safety, it's crucial to consider the effectiveness of current measures and whether more aggressive strategies are needed. What are your thoughts on the current response to West Nile virus in your community? Do you believe more should be done to combat this issue? Share your opinions in the comments. Mosquito control operation in Bristol Twinper, protecting against West Nile virus. Bucks County is taking aim at a buzzing health threat, but here's what you need to know. Residents of Bensalem and Bristol Townships, listen up. Bucks County's health department is launching an ultra-low volume ULV mosquito control operation to tackle the surge in both pesky and disease-carrying mosquitoes, scheduled to begin at 8:15 p.m. on Monday, August 4th. This initiative targets areas where mosquito populations are spiking and where the West Nile virus has been detected. The goal? To protect communities from the risks of West Nile encephalitis, a serious brain infection that can result from bites by infected mosquitoes. How it works. Specialized trucks equipped with Bucks County seal logos will spray a pesticide called Duet at a rate of 0.75 ounces per acre. This product is engineered to swiftly eliminate adult mosquitoes while minimizing harm to humans, pets, and non-target insects. The county emphasises that Duet has a low toxicity profile and is applied in a way that avoids long-term environmental damage. However, here's where it gets controversial. Some environmental advocates question whether chemical solutions like this should be the go-to strategy, especially with growing interest in eco-friendly alternatives. What's your take? Share your thoughts below. Where and when treatments will cover specific zones in Bensalem Township. The Bensalem Country Club area bordered by Atlantic Avenue, Brown Avenue and Humeville Road. In Bristol Township, neighbourhoods near Route 13, Bristol Pike, River Road, 2nd Avenue, Neshaminy Marine Drive, 5th Avenue, 4th Avenue and Coventry Lane. Weather woes. If rain or unexpected conditions halt the operation on August 4th, the team will try again on Tuesday, August 5th. The county is keeping its fingers crossed for clear skies. Your role in the fight. While the trucks do their part, you can help too. Mosquitoes thrive in stagnant water, so inspect your property for hidden breeding grounds, clogged gutters, kiddie pools, old buckets, or even a forgotten flower pot. A quick drain and dump can make a big difference. For extra protection, slather on bug repellent and wear long sleeves during peak mosquito hours, dawn and dusk. Curious about the science behind West Nile Virus or how to spot symptoms? Check out the Pennsylvania Department of Health's resources at www.dep.pa.gov/West Nile. Still have questions? Reach out to Bucks County Health at 215-345-3318. They're ready to address concerns or confirm spray schedules. P.S. Before you go, here's the part most people miss. Did you know cannabis is being explored for its potential benefits in women's health? Dive deeper into this trending topic at the growing use of cannabis in women's health. And if you need personalized guidance, meet your local canna coach here. It's free and expert-led. Got opinions on mosquito control methods? Drop a comment and let's debate the pros and cons of chemical versus natural solutions. Because when it comes to public health, every voice matters.